Okay, Blaine, I think I'll get us started today. So first of all, welcome to everyone for participating in our Medicaid monthly virtual forum, July the 17th of 2025. We are always happy to get community participation at every level. So thank you so much for joining us today. I'm also going to be going over the agenda, Blaine. So first, I've already given your welcome and introduction, and my name is Leslie Hoffman, and I'm a Deputy Commissioner in the Department for Medicaid Services. Second, Wayne, we're still getting some folks in the other on the other invite, just an FYI. So the agenda for today, we're going to go over the Healthy Kentucky Home Spotlight Substance Use Disorder, which is SUD, and harm reduction. We will also be going over Kentucky's Medicaid new provider directory. We will also be reviewing the 1115 community engagement waiver, the 1915C community health for improved lives and development, which is our child's waiver. We will also be going over the 1915I SMI RISE, which is recovery and support and engagement. And we are also going to go over the Kentucky Medicaid Diabetes Continuous Glucose Monitoring Grant Program, as well as the Medicaid renewals. So I am going to kick it over to Dr. Terrio, who will be going over our Healthy Kentucky Home.
Good morning, everybody. Next slide. It's great to be here again, and this is our monthly shout out to our Healthy Kentucky Home. July's theme is substance use disorders and harm reduction. Next slide. And we will again follow the same pillars that we've been doing for the whole year. So just to level set for everyone, substance use disorder is also known as addiction, and it occurs when an individual compulsively misuses drugs or alcohol despite knowing the negative impact it has on their life. Harm reduction is trying to reduce those consequences that are associated with using drugs. And it's important, a very important component to help prevent, treat, and encourage recovery. And so those are the two things we're going to do or touch on today. The pillars of our Healthy Kentucky Home campaign are really good. It really fits into people struggling with substance use because it's, as you guys know, talking about healthy eating pattern, regular physical activity, and then building a strong sober support system that will help you through your recovery journey. So next slide. Just really quick, in 2024, in the United States, more than 80,000 people died from overdose, and 1,400 Kentuckians died from overdose, and that was last year. So we do have a big problem. We're getting a little bit better, but it's still something that we have to fight, and so we'll just keep on fighting. These numbers are from the CDC. So next slide. First off, healthy eating can really help people in recovery. If you're eating healthy, getting your vegetables, getting your vitamins, it really boosts brain health. It helps improve your mood, and it can help some of those physical symptoms of withdrawal that you can feel, and it really does help the healing process. So not only regular meals, but healthy meals, healthy eating pattern is very important. And so our Healthy Kentucky Home asks everyone to have two servings of fruits and vegetables a day. That's all you got to do. A banana, eat a banana. That's one down already. So just try and increase to 2 servings of fruits and vegetables a day. It doesn't sound like much, but it's hard. When you start counting and you start realizing what you're eating and I guess what you're not eating, it helps you be more conscious of what you're putting in your body. So next slide. Again, with the increased physical activity, if you make this part of your daily life, and I'm not saying exercise on purpose, I'm saying increase physical activity. So take a walk around the block, walk across the street to say hi to your neighbor, that's more than you did the day before. So that's all you got to do. When you do that, that relieves stress. It really does. It helps anger and frustration, and it really does improve your sleep. And I can't say too much about improved sleep. I think everybody in my life and maybe even on this call have a problem getting to sleep, staying asleep, getting enough sleep. Even if you fall asleep when you get in bed, you're only doing 5 hours instead of 8 hours. Truly, adults need 8 to 10 hours of sleep a day for healthy sleep. And just try and think about the last couple of days and how much sleep you actually got. So I know it's hard, but if you can improve your sleep, that will help. It'll help stress. It'll help everything. So try and be cognizant of that. And physical activity will help with your sleep. So next slide. The third pillar is engaging with others. And this, I cannot say enough about how important this is for people in recovery. Engaging with others who understand your recovery journey is essential to success. You have to connect with people that know what you're going through and have been there and have come out on the other side. So connecting with people is very, very important. And next slide. Some of the harm reduction things that we can do, I think everyone's heard of naloxone. It saves lives. It reverses the effects of an overdose. Medicaid members can go into a pharmacy and get a prescription without or get naloxone without a prescription. And so it is available. I think everyone needs, if you have a loved one that is in recovery or is having an issue with substance use, you should have this. You should have this at home just in case. We also have a website, and I'll share with you later, teaching you how to use the naloxone. So just having this around can save a life. That's one of our harm reduction components. Another one is our needle exchange programs. Those are available in every county, and that will help help people not get infections, infections that can involve their heart. I mean, like serious infections, and that has helped people in Kentucky a lot. So next slide. Oftentimes, substance use goes hand in hand with depression and some other mental health issues. If you have someone that is in a crisis, if you have someone that is depressed or is suicidal, this is the number to call. You will be able to contact somebody right away to talk to. It's 24/7. I know we've mentioned 988 before, but this is all you have to do. 911 is for a physical emergency. 988 is for a mental health or substance use emergency. So next slide. And I just wanted to remind people that recovery is actually real. 7 in 10 adults who have substance use are in recovery. So it can happen. You can get through it. All you got to do is start. So it is actually doable. So you don't hesitate and think that you can't do it, because you can. So next slide. And this is the summary slide. So how do you improve your health? You eat healthy foods, you exercise regularly, walking, and you engage with others. Very important. So everybody go out, 2 fruits and vegetables a day, some sort of increased physical activity, even if it means when you're watching TV, when the commercials come on, you stand up and do something. You can dance, you can just do something, sit back down when the commercial goes off. I've actually done that, and you get a lot of exercise if you do that. And then engage with others. And last slide. These are just some helpful websites that you can go to when you get these slides. It's our harm reduction website, a Find Naloxone Now website, which also has the instructions on how to use it, and then 988 Lifeline, and then, of course, a Find Help Now website, which will help connect you to providers. And that's it. Thanks, Blaine.
Thank you, Dr. Terrio. I think next on the agenda is Kentucky Medicaid's new provider directory.
Good morning, everyone. I'm Chris Turner, an Assistant Director within the Division of Program Integrity, and I'll be giving a brief overview of the new Medicaid Provider Directory. We have designed a new directory that now allows searches to include the member's preferred language, provider accommodations, telehealth providers, and whether or not the provider is accepting new Medicaid or CHIP patients. The directory will also display the provider's website, if applicable, and information on whether the provider offers cultural and linguistic capabilities. The first slide here is the new provider directory webpage. Let's see. Yes. And as you can see, there are actually two provider directory options. We now have a directory specifically for waiver providers, and then a new directory contains all Medicaid providers. Next slide, please. When you click on the waiver provider directory link, this is the page you will see. Your search on this directory will include information such as waiver services, specialties, locations, and phone numbers for the provider. Next slide. For example, this is what you will see if you were to search for an HCB waiver provider in Hardin County. It brought up two organizations listing their address, phone number, and specialty. Next slide, please. Okay. This is the landing page for the new provider directory. This directory will allow you to search for all Medicaid providers. At the top, you will see that you can search by zip code, provider type, specialty, whether the provider offers telehealth, is accepting new patients, any language services offered by the provider, and accommodations they may offer. As an example, on this page, I searched for a primary care provider within 15 miles of zip code 40291 that was accepting new Medicaid patients and also offered accommodations for a patient that may need assistance with transfers. And you can see in the dark blue space below that it listed providers or all providers that met this search criteria. Next slide, please. Once you click on a specific provider, these are the details you will see. Provider name, type and specialty, address, phone number, website address, percent of patients that are seen in that office that are over and under 21 years of age, language services offered, whether they offer cultural capabilities, and a list of accommodations the provider offers. Also included is a map. And if you click on the blue dot, it will open up Google Maps to give you directions to the provider's location. Last slide, please. The new directory went live this month on July 1st, and around the 27th of each month, the directory will update to show the most recent office information the provider has entered. We encourage providers to update their office information in the Medicaid Partner Portal system as soon as possible so that the most accurate information will always reflect in the provider directory. In the near future, we will be making some minor updates to the directory to include the ability to search by NPI and taxonomy, the ability to search by county, and also some visual changes to the layout of the search and provider detail pages. So please visit the directory often to see the upcoming changes and new details as providers update their information. Thank you.
Thank you so much, Chris. Next on the agenda is the 1115 Community Engagement Waiver, and I will be going over that information. Blaine. Next, okay. So this is just an overview, and if you've participated in our monthly forums, this may be some repeat, but just to answer all the questions that you might have, this is an overview. So Kentucky House Bill 695, which was in the 2025, established requirements for our cabinet, CHFS, to implement a community engagement program. CHFS has submitted an 1115 demonstration proposal to the Center for Medicare and Medicaid Services, CMS, that's our authority, to automatically refer eligible Medicaid members to the Department for Workforce Development, DWD. Eligible members are non-exempt Medicaid expansion adults who have been enrolled for more than 12 months and are of the ages of 19 to 60, are physically and mentally able to work as defined by our cabinet, CHFS. The Department of Workforce Development will contact those members to offer job coaching, skills training, and employment support. Next slide. So within the 1115 demonstration, we had the ability to include member exemptions. So our cabinet will exempt Medicaid expansion eligibility group members who meet at least one of the following conditions from the automatic referral to the Department of Workforce Development. So again, it's individuals under 19 or over the age of 60, individuals responsible for the care of dependent child under the age of 18, or it also can be the care for a dependent disabled adult relative. Individuals with a diagnosed SUD or a substance use disorder or an SMI, serious mental illness, a chronic disease as determined by our cabinet, an acute medical condition, physical and or behavioral, that would prevent them from complying with these requirements. Individuals whose eligibility has been determined based on disability or who have been deemed disabled by our Social Security Administration, SSA. Individuals with verified earned income, individuals receiving unemployment insurance benefits, pregnant women, individuals who are homeless or who are recently homeless for up to 6 months post housing, and individuals who are victims of domestic violence, individuals who have recently been directly impacted with a catastrophic event, such as a natural disaster, which Kentucky has had several things going on in the last couple of years, or the death of a family member living in that same household. Individuals already participating in a workforce participation program that our cabinet has deemed or determined meets the objective of the Community Engagement Waiver Program, such programs that are included with SNAP currently. Former foster care youth up to age 26, other good cause exemptions as approved by our cabinet. I can go over some other things. Next slide, please, Blaine. So where are we with this 1115 demonstration right now? DMS successfully submitted our community engagement waiver to CMS on July the 25th, which was our date to have it completed, and we did meet that deadline. CMS notified DMS on July the 7th that the application is complete. So if you're wondering what in the world does that mean, oftentimes when the 1115s are submitted, especially when these are new authorities being requested, CMS will send us a letter and it says it's a letter of completeness. It says it pretty much meets all the criteria that we need. Now we've got a couple other steps before we can approve it. CMS posted the demonstration on the Medicaid.gov for a 30-day federal public comment period from July the 10th of 2025 to August the 9th of 2025. So if you're familiar with the process to have a Kentucky federal public comment period, often on new opportunities, they will actually go out and do another 30-day federal public comment. So we'll have to wait for them to complete that, and that should be done around August the 9th. Once they decide and receive those comments from the federal public comment and work with us about the answers and the questions related to those federal public comments, then they will go forth to see if they are indeed going to approve or not approve the 1115. If you have heard me talk about this before, this is an 1115. So there are other things that have to be completed after an 1115 is approved, such as an implementation plan approved by CMS, metrics and monitoring going forward that will be required of us, independent evaluations and things like that. So there's like 6 or 7 steps that we have to have approved by the federal government, even after the 1115 is approved, to actually implement it in the state of Kentucky. So I just wanted to share that with you. And then next slide, Blaine. So next on the agenda is the 1115 Community Health for Improved Lives and Development, which is the Child CHILD waiver. So the acronym is actually the word child. And I'm also going to include real quick, Blaine, some things in the chat that will include some acronym discussions. Next slide, please. So I must always include families first when I'm talking about the child's waiver, because I know there might be some confusion, because we have been working quite some time since last year on a plan for not just high intensity needs, but on a comprehensive multi-year initiative for enhancing the existing system of care for all children and youth across the board. So I always feel it necessary that I include this slide. Some things that you might see within this continuum, right, is Shine Kentucky, which is enhancing access and delivery of school-based services. And I put the acronym for Shine, which is strengthening health integration and education for Kentucky students, in the chat. You will also see Kentucky Cares. That was a grant that we also applied for services and supports for community reentry to improve care and transitions for all involved youth. I also put in the chat the acronym CARES stands for Continuity of Access to Resources and Essential Services. The CHI mapping is a tool that we designed to help us do tracking and documenting and reporting of children's health initiatives. I also put that in the chat. CHI stands for Children's Health Initiatives. So as you can see, these are just different phases that we have been going through to include within the Family First Initiative. The next one is the funding modernization, which is the restructuring of Medicaid payments for medically necessary treatment services. And then the next bullet that you will see with the two hands holding and the heart is actually a high needs service delivery, which is the 1915C child waiver that is designed to meet the child-centric care, supports and services, housing, custody, placement, and other health-related social needs. So the 1915C child's waiver is developed to meet a high-intensity service delivery need to specific children. And then you'll see in our last bullet, within the Families First initiative is a children's state plan amendment. Most likely would be an I, but I cannot tell you that at this time. It would be a state plan amendment to locate appropriate resources and housing for children and youth in the need of placement and services for children. So this is just a full continuum, and you can see based on this diagram where the 1915C child waiver falls. Families First seeks to create a unified, integrated, and child-centered care framework to address the diverse needs of Kentucky's youth population by enhancing coordination across health, education, social services, and all other key factors. Family First aims to ensure that every child and youth receives the necessary supports to achieve full potential. This initiative includes so many internal folks from our cabinet as well as those outside of our cabinet with things like education and the Department of Juvenile Justice and even pieces related to DOC, Department of Justice, Department of Corrections here in Kentucky. So I just want you to see where that child falls, that child waiver, the 1915C, falls within the continuum. Next slide, Blaine. So for the child's waiver, the 1915C, with an anticipated date of 2026, that's what we're working towards. The child waiver is a new Kentucky Medicaid program designed to help children and youth with significant behavioral health or developmental challenges to get services that they need while staying at home, in school, and in their own communities. Next slide, Blaine. So where are we currently with the child's waiver? The DMS waiver application was developed and it is currently available for review. However, the public comment period, if you remember when I was on last time, was talking about that was available. It actually ended through July the 15th of 2025, just a couple of days ago. However, you can still view it if you want to go to the website. DMS targets in August 2025 for submission to the Center for Medicare and Medicaid Services, CMS, which is our authority. As you remember me talking about the community engagement maybe last time we were on, there are things that we will work on, such as the public comment period, and we will answer the questions that were sent to us and have those back out for an internal cabinet review, as well as some external cabinet reviewing before we send those to CMS. So that will go with the application that we will be sending to the Center for Medicare and Medicaid Services. Next slide, Blaine. Okay, just some key features that we wanted to talk to everybody about. We do have a fixed number of enrollment slots for the 1915C child's waiver. A standardized needs-based assessment to determine a functional eligibility, Medicaid funded services not available through the standard benefit package that you would get through just plain state plan, and an individualized service plan and coordination for all members that are eligible and are participating within the child's waiver. Next slide, Blaine. So who does the 1915C child's waiver help? These are individuals that are under the age of 21 with a significant behavioral health or developmental need. It is Kentucky children and youth who need a level of care similar to what would be provided in a psychiatric residential treatment facility, which is our PRTF here in Kentucky, or an ICF IID or hospital. And our ICF IIDs are intermediate care facilities for individuals with developmental and intellectual disabilities. It can also can be individuals who can safely be supported at home or in the community with the right services. Next slide, Blaine. What services are going to be covered? These are similar services, but more, I would say more acute or intense for this population. So what you're going to see, if you are familiar with other services and other C waivers, would be case management, respite, which is relief of the caregiver, community living support, CLS, environmental and minor home modifications, clinical therapeutic services, supervised residential care. All services will be person-centered and delivered by trained waiver certified providers. And we will have a new provider type for this particular 1915C child waiver. I know you all have a lot of questions. I see a lot of things popping up in the chat. So once we get done, I will start, and Carmen Hancock, who's on with me today from long-term services and supports, will help to address the questions in the chat. Next slide, Blaine. Where can I learn more? So we thought, since we were out of public comment, although you can still view it, we thought you might be interested to know that you can still send information or questions to our 1915C waiver help desk, which we have an email address, and or we also have a phone number, 844-784-5614 for our help desk in long-term services and supports. And we also provided a child's waiver summary PDF if you want to take a look at that as well. And I think that's it for me. Again, when I get off just a second, I will start addressing the questions. And then we're going to go to participant directed services and PDS background checks. And I'm going to turn it over to Carmen Hancock.
Thank you, Leslie, and good morning, everyone. Thank you all for joining. I'm Carmen Hancock. I'm the Division Director for Long-Term Services and Supports, and I'm here just to give you some information about a recent change that was made with regard to background checks for those receiving participant-directed services or PDS services. Next slide. So here's some background. Just to set the stage, back in May of 2023, while we were preparing for upcoming waiver renewals, CMS, the Centers for Medicare and Medicaid Services, identified an issue with our 1915C waivers, the ones that offered participant-directed services. What they noted was that participants were responsible for or the employee or the representative was responsible for covering the cost of criminal background checks for potential employees for that PDS participant. According to CMS, the costs of obtaining these background checks, they felt, could disincentivize some people to take advantage of self-direction, especially if the individuals could not be hired without having those required background checks. And that is the case. Those background checks are required. So their feedback was that when those checks are mandated under state law, the cost of conducting these checks should not be deducted from the participant directed budget or from the participant unless it's incorporated into the budget. We no longer do budgets in that manner, but the gist of it is that cost could not be one that was the participant's responsibility. Their suggestion as a solution was to mirror what's happening in other states with participant-directed services, and that was to add the cost for those background checks, the cost for running the background checks, to the financial management service rate, or the FMS rate, as long as that was identified as one of their responsibilities. And maintaining background checks is one of the responsibilities for our FMS providers. So it was determined that that was the solution that we would go with, again, based on CMS guidance. Next slide, please. So we had been working through some of those identified issues with CMS in a very informal corrective action process. And again, one of those pieces was passing this cost along to the FMAs, the financial management agencies, who are getting paid to provide the financial management service. Financial management agencies did receive rate increases in 2022 and 2023. Those rates were made permanent at the beginning of this year, 2025, and the intent was to include the cost of background checks for PDS employees. And to clarify, it's not the cost of all background checks for PDS employees. The FMA is expected to pay for the cost of 4 background checks per level of care year for each participant. So what we've done in preparation, we did go to our PDS working group, which is a consortium of stakeholders, advocates, and other folks who have an interest in the participant-directed service in the state. We took this proposal to them on April 8th of this year, and they helped us draft a letter that would be going out to the public, letting them know what was happening. On May 2nd, we held meetings, Zoom meetings, with the CMHCs and the ads to present the new policy to them, letting them know that the policy was going to go into effect on July 1st. Letters were mailed to PDS participants on June 27th, notifying them about the upcoming change. And then again, policy went into effect just very recently on July 1st. So I wanted to show you all the letter that actually went out to PDS participants, and that's on the next slide. And I know it's a little small for you all to read, but essentially it's just us letting them know that the background checks would be, the first 4 background checks would be the responsibility of the financial management agency effective July 1st. And they're also responsible again for maintaining paperwork, criminal background checks, running employee payroll, and that sort of thing. So this absolutely made sense in terms of moving forward in this direction. So again, thank you all for coming, and just wanted to share with you that recent change.
Thank you, Carmen. And next we have Tanya up with the RISE initiative, which is our Recovery Independence Support Engagement, SMI 1959.
Great, thank you. I'm glad to be here and join you guys today. My name's Tanya Dickinson, and I'm part of the 1959 RISE initiative with the Department for Behavioral Health, Developmental, and Intellectual Disabilities, or BDID. 1959 RISE is a joint effort of Medicaid and BDID and focuses on helping individuals rise above their challenges through services that promote RISE, independence, recovery, independence, support, and engagement for RISE in the community. Today I've just got a quick overview of the program, but we have lots of resources available where you can learn more. Next slide, please. All right. The 1959 RISE initiative is a new Medicaid benefit under Kentucky's 1915I state plan amendment. Provider enrollment opened July 1 and participant enrollment opens September of 2025. It's designed for adults who are 18 or over with serious mental illness or SMI, with or without a co-occurring substance use disorder or SUD. It brings 10 essential home and community-based support services into communities for these individuals. The first is assistive technology, case management, housing and tenancy supports, in-home independent living supports, medication management, planned respite for caregivers, supervised residential care, supported education and employment, and non-medical transportation. It begins with our first phase of our go live was initiating the bringing providers on. And we're doing that now. We've had that open since July 1, and we've had a number of people register for the process, and we've received questions and I think a couple of applications already that are in place. The CEO of an organization completes an initial online orientation and submits a certification application packet to us via email. We review the packet and provide feedback and technical assistance, followed by a notice of an initial decision on proceeding with the application within 10 business days of receipt. While we conduct a more extensive review of the provider's facilities and operations, including staff credentials, experience, service alignment with a fidelity model, business documentation like tax ID and licensure. Then we'll also do a site visit. The CEO or their designee completes more focused online training. And then once the certification is approved, providers will enroll in Medicaid, if not already. There's a distinct provider type, and TheraP, which is the 1959 RISE data system, and begin some extensive online staff training for individuals who will be in direct contact with participants. Approved providers will also be added to BDID's online provider directory and be eligible for selection by participants. And after the participant services are commenced, the provider will participate in the continuous quality improvement process and ongoing training opportunities. Once we have providers in place, around the end of the summer, we'll begin accepting participant referrals around, again, like September 2025. We don't have a hard day yet. Just so you know what the participants' process is going to look a little bit like. When that time comes, anyone can contact the RISE program on behalf of a potential participant, the individual, family, clinician, hospital, whomever. Once a referral is received, an intake specialist will complete an eligibility screening via telehealth to ensure Medicaid eligibility, qualifying serious mental illness diagnosis, and their housing status. A trained assessor will meet with potential participants at a convenient location or via telehealth to conduct a more extensive functional assessment. The process is expected to take a number of hours to complete and may be spread out over a few days. Supporting documentation may be requested from the individual, previous providers, etc. Once the participant receives notice of approval for services, program staff will assist them in choosing a case manager from available certified providers. Then the case manager will collaborate with the individual to jointly complete a person-centered service plan and select providers for one or more of the approved service types. The participant may suggest or decline specific services, and these will be noted in the plan. In other words, the participant is the driver of this process, and we are facilitating it, as are all home and community-based services. The The person-centered service plan is then regularly reviewed and updated as long as the participant is receiving services. Next slide, please. The 1959 RISE initiative has had a number of developments here recently. We've got 50 plus providers have begun the application process. We've had staff in place as of July 1. We have a provider webinar scheduled for July 22nd, 1 to 2:30 p.m., where we're hoping to answer questions for folks, give them a little more, well, actually a lot more in-depth information about the program, and then we'll follow up with groups or individual providers as necessary afterwards. We have 2 email boxes, one for general inquiries at 1959 RISE Initiative, and one specifically dedicated to provider inquiries, 1959 RISE Provider at ky.gov. I'll drop all those in the chat. I can't talk and put things in the chat at the same time. I don't have that much talent going for me. I'll also put our webpage address in, and the first thing you'll see on the webpage is the invitation to the provider webinar. So if you click on the link that's there, it will take you to a registration, and then hopefully we'll see a number of folks next week at that. And that is all.
Thank you so much, Tanya. Next on our agenda is a Kentucky Medicaid Diabetes Continuous Glucose Monitoring, and that's CGM grant program.
Hello, I'm Letha Harris, branch manager of the Population Health branch in the Division of Quality and Population Health, and I'm here to, as Leslie said, provide an update around this program. So Blaine, next slide, please. Some of you all maybe that attended last November's meeting, and we provided an update around this grant, but I will share just a brief overview that this grant project started in October of 2023 and will end phase 1 this coming September. And this grant was made possible through the Center for Health Strategies and the Helmsley Trust. The project is focusing on improving diabetes care and awareness in the Medicaid population, and expand access and increase of utilization of CGMs. And we want to support the proper CGM usage to manage their A1C levels and improve diabetes outcomes. This project has involved very close collaboration across multiple departments within the cabinet, across the divisions within the department, and external partners to ensure a successful implementation and impact. We really are focusing on this for almost 2 years now and into the future, because diabetes is very prevalent among Medicaid members and across our state, and CGMs help manage the diabetes, but also remove the need for diabetics to perform those finger sticks, and the sensors provide electronic data to assist with managing the highs and lows of your blood sugar levels. Providers can use those. So through this project, we've been able to complete several key milestones. And so next slide, please. One of the first ones that actually occurred just over a year ago was within Medicaid, there was a change to that CGM policy. Prior to that, CGMs were available for members who were insulin dependent and had a diagnosis of type 1 or type 2. That policy change now includes those members with type 1 and type 2 diabetes, but now includes members with a gestational diabetes diagnosis and members who have a history of problematic hypoglycemia, with level 2 or level 3 hypoglycemic events, as you can see here. And when these slides are shared, there is a link for members and/or providers who would like to see more of the approved supply list and the criteria around those. And while CGMs are within the pharmacy benefit, managed care organizations may cover them through the durable medical equipment policy, which may have different guidelines different from this pharmacy. So we saw through the data that some members that we thought would benefit from access to CGMs were not, and our pharmacy team acted quickly to change this policy, and we are seeing within the data members accessing CGMs and hopefully being able to manage their diabetes. One of the next things, slide 2, please. is that we did a provider survey earlier this year. And we also, as we mentioned, know that diabetes is very prevalent amongst our members. Was that maybe creating a Medicaid member resource page and a Medicaid diabetes provider resource page within the DMS website would be beneficial. So we did, and those went live just last month, and we were very excited about that. And now the information on there is really sharing information that is readily available, but it's something you might have had to go search for before. And now you can just land on these pages and find numerous resources available and information, again, for members and or providers to help our members manage diabetes. And here are the links. And as the speaker before me just mentioned, I will drop the links after I finish speaking into the comments for you to access. And when you do access those, next slide. You will then, we would love everybody to go and visit those pages, because when you do visit those pages for the first time, you are going to receive a pop-up asking you to join our Gov Delivery. So our cabinet has a Gov Delivery program. I don't know if anybody has signed up for channels or not, but numerous departments across the cabinet use Gov Delivery, and Medicaid does have a Gov Delivery channel. And within that, we have created topics. And so now you can specifically sign up for Medicaid's diabetes channel, and you will receive updated campaign messaging. And the first campaign that we have established for members and providers is out now. So once you sign up, within a week or two, you will receive an email with campaign messaging, just again sharing information about diabetes management, educational opportunities, CGM information, and links to our web pages. And so the first one, again, is out and going live now. If you've already signed up, you may have received it, and work on that campaign number 1. And next slide. And then shortly after campaign 1, campaign 2 is going live for providers. So when you sign up for that Gov Delivery channel, it is just going to ask for your email and whether you are a provider or a member. That way you can receive targeted messaging that will assist you and or your patients that you're serving or those that are within your care. And so I believe that is there, I believe, yes. And so that's my last slide. And the last thing I will drop those links in the thing. And thank you all.
Thank you so much, Letha, for the information on the grant program. And next up will be our Medicaid renewals.
Hello, good afternoon. This is Jordan with the Department for Medicaid Services. I'm the Eligibility and Enrollment Branch Manager, and we're going to kind of go over some information about our flexibilities and renewal information for post-June 2025. Next slide, please. So as you may be aware, during the public health emergency unwinding, we were allowed to implement multiple flexibilities to support members throughout their renewals. These flexibilities were temporary, permitted by the Centers for Medicaid and Medicare Services to simplify the renewal process, reduce inappropriate terminations, and allow the state to manage the increased workload. So important to note, many of these temporary flexibilities did end on June 30th, 2025. And while some of them have been made permanent, there are a few that will end that we want to make members aware of. So most notably, our child continuous coverage has ended, meaning that once again, all children will be required to go through their annual renewals. Children have not been required to do that since the start of the pandemic. So we want to make sure that families and guardians are prepared and know that as of July, their annual renewals for children will continue. For all members, the extensions that were allowed to be applied if a member didn't reply to their renewal have also ended. So this means that all members will no longer have a 1-month extension if they do not respond to their renewal notice or RFI, which is a request for information. For long-term care and waiver members, this was a 3-month extension, and so this is also ended. And members must respond to their renewal by their renewal due date to avoid any procedural terminations. Lastly, of note here is that the state can no longer allow an authorized representative to sign their application or renewal via the telephone if there is not already a signed designation on file. And if someone does not respond to a renewal by their renewal due date, they will be terminated. Families should call us as soon as they discover they are no longer covered for that lack of response. If they are determined eligible within 90 days of their original termination, their coverage may go back to the date of that termination. Next slide, please. So the main things for members to remember is what you can see on this slide. So make sure that your information is updated so we can reach you when it's time for your renewal. If you hear from the Department for Medicaid Services or from the Department for Community-Based Services, make sure you respond. It's very important you do so. There is help available. You can leverage connectors, our DCBS agents in local offices, the Connect call line, and licensed insurance agents are available to help with a wide range of questions. So just make sure, we want to make sure you know how to get help if you need it. Next slide, please. Now, so for a little bit of an update on our Medicaid enrollment trend, this slide is the most current look at our Medicaid enrollment here in Kentucky. As we shared before, this is an anticipated decline from the beginning of 2023 following the public health emergency unwinding. So we have worked through all of the initial renewals following that public health emergency. And so now you can see that we're hovering around 1.45 million, and this has been holding steady. Next slide, please. As shared before, we started moving on with our normal eligibility and enrollment practices for renewals, which includes typical annual renewals. We do have those few flexibilities still in place through June 2025. Well, that's ended now. So we've been working to ensure that there's numerous communication materials that support members with understanding Medicaid and working to make sure that the materials can be shared with members. Specifically, we're going to be sharing a communications packet specifically designed to support families and guardians as their child goes through their first renewal since the public health emergency. Lastly, we continue updating our monthly reports to CMS. We report these renewals each month, and then after the 90 days, we update the report to show how pending cases were processed within that 90 days. These are all available on our website, but we can take a brief look now. Next slide, please. So on this slide, you can see those reports at high level. On the left-hand side, you'll see the original monthly report month. So for example, let's see. So for example, our March 25th date, you see the information there. And then our updated CMS monthly report is on the right-hand side. Next slide, please. So beyond that, this is looking at the current last 3 months. We track this differently because these months are still within their 90-day reinstatement flexibility. So what that means is if a member is terminated but comes back within 90 days and provides the requested documentation and we determine them eligible again, we can reinstate their coverage back to that termination date. These reports highlight members that are approved, terminated, pending processing, and extended. Those extensions were part of the flexibilities that have since ended as of June. You can see those numbers on the right-hand side of the slide. And again, all of these reports are available on our Unwinding website if you want to look through those with more detail. Next slide, please. So beyond the materials for children, we also want to make sure that all members know about what's going on, how they should respond, how to get help if they need it. These materials are available online for anyone to use and share with members in the community, and we encourage you to check them out and use them in your offices and day-to-day. Next slide. So as we mentioned, again, at the beginning of today's presentation, that the continuous coverage for children will be ending soon. Children have specific renewal requirements for Medicaid and CHIP. So to support families and guardians with their child's renewals, we're focusing heavily on this population and the ongoing outreach. We've developed a packet of materials that we disseminated broadly that includes this information for what you need to know, materials to take from the packet, and you can take that and use with your audiences. The main messages that are important is to make sure members know that this is coming, to stay connected, and to respond even if they think they're not eligible. These are available online on the PHE website and the Kids Help page. Check them out and use them to help families. Next slide, please. So we've also developed a member toolkit for members to understand their coverage, how to use it, what it offers, and more about renewals too. It's available online already at the DMS member website, and the translated versions will be up shortly. Next slide. We also remind folks that there's a lot of information on that website for the unwinding. There are flyers for navigating the renewal process, helping members with things like ID proofing for Connect accounts and materials for providers and connectors that they can download and use. But anyone should feel free to take these and use them to help others to learn more. They're so applicable today in lots of instances. So this is a snapshot of the website. Like we mentioned before, it has reports, flyers, any kind of additional information that you would like can be found on this website. Next slide. And that's it for the renewals. Thank you all.
And Blaine, I believe that's it. Is there anything else we need to go over? I believe that's all we have for today. And see that we had really good participation today. We do always ask if you have topics you'd like for us to discuss and let us know what you might want to hear about next time. We often pick hot topics or programs that we're currently working on through the budget, so that you all might be interested in, changes that are coming about and things like that. But we would like to hear from you about anything that you would like to know more about, and we can assist with that, and just reach out to us. If Blaine, next slide, is that it? Just double checking before I end. Thank you so much for all your participation. It looks like we had lots of folks on today. So we will see you next time. And again, reach out if you've got anything that you would like us to add to the agenda. And take care.